Question 1. A patient presents with severe abdominal pain due to acute appendicitis. The patient also has a history of chronic gastritis. What is the correct sequencing for the diagnoses in this encounter? A. Chronic gastritis, acute appendicitis, abdominal pain. B. Abdominal pain, acute appendicitis, chronic gastritis. C. Acute appendicitis, abdominal pain, chronic gastritis. D. Acute appendicitis, chronic gastritis. Answer: D. Acute appendicitis, chronic gastritis. This question tests your understanding of primary diagnosis sequencing in ICD-10 CM. The chief reason for the encounter, acute appendicitis, is the primary diagnosis because it is the condition requiring the patient's current visit and treatment. The abdominal pain is a symptom of the appendicitis and would not typically be coded separately when the definitive diagnosis is known. The history of chronic gastritis is a coexisting condition but not the reason for this specific encounter. Always sequence the diagnosis that is the main reason for the visit first. Question 2. Which of the following modifiers indicates a significant, separately identifiable evaluation and management E/M service performed by the same physician on the same day one as a minor procedure? A. -59. B. -24. C. -25. D. -78. Answer: C. -25. This question asks about a specific CPT modifier used in certain billing scenarios. Modifier -25 is appended to an E/M code to indicate that the physician provided a distinct E/M service above and beyond the usual preoperative and postoperative care associated with a minor surgical procedure performed on the same day. Modifier -59 is used to indicate a distinct procedural service, while -24 is for unrelated E/M service during a postoperative period, and -78 is for return to the operating room for a related procedure during the postoperative period. Remember that modifier -25 tells the payer that the E/M visit wasn't just part of the procedure itself. Question 3. In medical terminology, what does the prefix dis- mean? A. Above or excessive. B. Below or deficient. C. Painful, difficult or abnormal. D. Around or surrounding. Answer: C. Painful, difficult or abnormal. This question tests your knowledge of common medical terminology prefixes, which are crucial for understanding documentation. The prefix dis- is consistently used to indicate something that is difficult, painful, or abnormal. For example, dysphagia means difficulty swallowing, and dyspnea means difficulty breathing. Understanding this prefix can help you decipher the meaning of many medical terms you encounter in coding. Learning common prefixes like dis- is a great shortcut to understanding complex medical words. Question 4. A patient is diagnosed with metastatic bone cancer originating from the lung. In ICD-10 CM coding, which site is coded as the primary malignancy? A. The lung. B. The bone. C. Both the lung and the bone are primary. D. Neither site is considered primary. Answer: A. The lung. This question focuses on coding malignancies with metastasis in ICD-10 CM. When cancer has spread, metastasized, from one site to another, the original site where the cancer began is considered the primary malignancy. The site it spread to, the bone in this case, is coded as the secondary malignancy. Always identify where the cancer started to correctly assign the primary code. Think of the primary site as the cancer's home base before it traveled. Question 5. What is the primary purpose of the ICD-10 CM tabular list? A. To provide an alphabetical index of terms and their corresponding codes. B. To list codes in alphanumeric order with supplementary instructions. C. To define medical terms and anatomical structures. D. To outline coding guidelines and conventions. Answer: B. To list codes in alphanumeric order with supplementary instructions. This question asks about the structure and purpose of the ICD-10 CM codebook. The tabular list is where you find the actual codes listed sequentially by chapter, category, and code number. It includes instructional notes like includes, excludes, code first, and use additional code notes that are essential for correct code assignment. The alphabetical index helps you locate potential codes based on terms, but the tabular list confirms the code and provides necessary details. Always confirm the code you find in the index by looking it up in the tabular list. Question 6. A coder is reviewing documentation for a radiology service described as a chest X-ray, PA, and lateral views, with written report. According to CPT, which component is necessary for the coder to assign the professional component of the radiology code? A. Documentation of patient positioning. B. The technical component performed by the technologist. C. The supervision and interpretation by the radiologist. D. The order from the referring physician. Answer. C. The supervision and interpretation by the radiologist. This question relates to coding radiology services, specifically the different components of those services. Radiology codes typically have a professional component, PC, and a technical component, TC. The professional component represents the radiologist's work, including supervising the procedure and interpreting the images to create a written report. The technical component covers the equipment, supplies, and technician services. To code the professional component, the radiologist's interpretive report is essential. Remember that the radiologist's analysis and report are key to the professional fee. Question 7. In ICD-10 CM, the X character is used as a placeholder for which reason? A. To indicate an unspecified code. B. To reserve a character for future code expansion. C. To allow for the addition of a seventh character. D. To indicate an incomplete code. Answer. C. To allow for the addition of a seventh character. This question tests your knowledge of a specific ICD-10 CM convention. The X is used as a placeholder character in certain codes when a seventh character is required, but the code doesn't have 6 characters naturally. It fills the empty spaces to ensure the seventh character is in the correct position. Without the X placeholder, the seventh character would be in the wrong position, making the code invalid. The X is like a placeholder setting the stage for that important 7th digit. Question 8. Which of the following is typically reported using HCPCS Level 2 codes? A. Inpatient hospital services. B. Physician's evaluation and management services. C. Durable medical equipment, DME, and supplies. D. Surgical procedures. Answer. C. Durable medical equipment, DME, and supplies. This question differentiates between CPT, HCPCS Level 1, and HCPCS Level 2 codes. CPT codes primarily describe physician and other qualified healthcare professional services, including E/M, surgery, and procedures. HCPCS Level 2 codes are used to report products, supplies, materials, and certain services not included in CPT, such as ambulance services, DME, and drugs. Think of HCPCS Level 2 codes as covering the stuff used in healthcare, like crutches or bandages. Question 9. According to ICD-10 CM guidelines, what does an excludes one note indicate? A. The conditions are mutually exclusive and should not be coded together. B. The condition excluded is not part of the condition it is excluded from, but a patient may have both conditions at the same time too. C. The code can be used in conjunction with the excluded condition. D. The excluded condition is a synonym for the code above the note. Answer. A. The conditions are mutually exclusive and should not be coded together. This question tests your understanding of a critical ICD-10 CM coding convention. An excludes one note means that the condition listed after the note is not included in the code above the note, and the two conditions cannot occur together. Therefore, you should never code both codes together. An excludes to note, in contrast, means the condition is not included but can exist alongside the code above the note, and both can be coded if documented. Pay close attention to excludes one notes. They are a strict rule about coding two conditions together. Question 10. A patient is seen for a follow-up visit to check on controlled hypertension and also presents with a new complaint of a cough, which the physician evaluates. For E/M coding purposes, how would the physician's work regarding the cough typically affect the complexity of the visit? A. It is irrelevant since the visit was scheduled as a follow-up for hypertension. B. It would increase the complexity of the medical decision-making. C. It would only affect the time component of the visit, not the medical necessity. D. It would be considered part of the management of the controlled hypertension. Answer. B. It would increase the complexity of the medical decision-making. This question relates to coding evaluation and management E/M services, specifically how new problems affect visit complexity. When a patient presents with a new problem during a visit for a stable or controlled condition, the physician's evaluation and management of that new problem significantly increase the complexity of the medical decision-making (MDM) component. MDM considers the number and complexity of problems addressed, the amount and complexity of data reviewed, and the risk of complications 3 and/or morbidity/mortality. Addressing a new problem typically means more data review and higher risk. Remember that handling a new issue during a visit makes the doctor's thinking and planning more complex. Question 11. Which term describes a malignant tumor of glandular tissue? A. Sarcoma. B. Carcinoma. C. Lymphoma. D. Myeloma. Answer. B. Carcinoma. This question tests your knowledge of basic medical terminology related to cancer types. Carcinomas are malignant neoplasms, cancers, that arise from epithelial tissue, which includes the tissue lining organs and glands. Sarcomas arise from connective tissue. Lymphomas affect the lymphatic system, and myelomas affect plasma cells in bone marrow. Knowing that carcino relates to epithelial tissue helps identify carcinoma as the correct answer for glandular tissue cancer. Breaking down medical terms into their roots, prefixes, and suffixes is key to understanding them. Question 12. According to CPT guidelines, what is included in the global surgical package? A. The surgical procedure only. B. Preoperative visits, the surgical procedure, and postoperative visits. C. Anesthesia administration and the surgical procedure. D. Only follow-up visits related to complications. Answer. B. Preoperative visits, the surgical procedure, and postoperative visits. This question asks about the components of the CPT Global Surgical Package, which bundles together various services related to a surgical procedure. The global package typically includes the surgery itself, necessary preoperative services within a defined period before the surgery, and routine postoperative care for a specific period following the surgery. This bundling simplifies billing and payment for surgical episodes. The global surgical package covers the complete episode of care surrounding the surgery, not just the procedure itself. Question 13. A patient undergoes an appendectomy due to acute appendicitis. Several months later, the patient develops a post-surgical hernia at the incision site. How would the post-surgical hernia be coded in ICD-10? A. As a complication of the surgery. B. As an unrelated condition. C. As a sequela of the original appendicitis. D. Only the acute appendicitis is coded. Answer. A. As a complication of the surgery. This question tests your understanding of coding complications and sequelae in ICD-10. A post-surgical hernia occurring after an appendectomy is considered a complication of the surgical procedure itself, not a sequela of the original appendicitis condition. Sequelae are conditions that are residual effects of a previous illness or injury. Complications are conditions arising directly from treatment, such as surgery. Look for codes specifically describing complications of surgical procedures when coding conditions like this. Identifying if a condition is a direct result of treatment is crucial for correct complication coding. Question 14. What does the abbreviation NEC stand for in ICD-10? A. Not easily classified. B. Not elsewhere classifiable. C. Not entirely coded. D. New entry category. Answer. B. Not elsewhere classifiable. This question tests your knowledge of ICD-10 CM coding conventions and abbreviations. NEC is an abbreviation used in the ICD-10 CM codebook. It appears when the documentation provides a specific diagnosis, but there isn't a more precise code available in the classification system. It indicates that the physician's documentation is specific, but the codebook is not. Use NEC when the medical record provides more detail than the available codes allow for. Question 15. Which Z code category is used to report encounters for routine internal organ and tissue donations? A. Z00, Z13, persons encountering health services for examination. B. Z40, Z53, encounters for other medical care. C. Z54, Z65, persons with potential health hazards related to socioeconomic and psychosocial circumstances. D. Z99, dependence on enabling machines and devices, not elsewhere classified. Answer. B. Z40, Z53, encounters for other medical care. This question asks about the appropriate use of Z codes for specific types of encounters in ICD-10. The Z codes within the range Z40, Z53 are used for encounters related to other medical care, which includes procedures like organ and tissue donation, Z52. Routine examinations, Z00, Z13, are for general checkups without specific complaints. Always check the Z code categories and their descriptions to find the correct code for encounters not related to illness or injury. Z codes are essential for reporting reasons for visits that aren't about sickness or injury. Question 16. When coding burns in ICD-10 CM, a seventh character is required to indicate A. The body surface area affected. B. The depth of the burn. C. The encounter type, initial, subsequent, sequela. D. Whether the burn is intentional or accidental. Answer. C. The encounter type, initial, subsequent, sequela. This question focuses on the requirement for a seventh character in certain ICD-10 CM codes, specifically for burns. For most injury codes, including burns, a seventh character must be added to specify the type of encounter, for initial encounter, while the patient is receiving active treatment, D for subsequent encounter, for routine care during the healing phase, or F for sequela, for complications or conditions arising after the initial injury has healed. The other options are important details for coding burns but are captured within the first 6 characters of the code. Remember that the 7th character tells the story of where the patient is in their recovery journey. Question 17. A patient presents with pain and swelling in the knee due to osteoarthritis. In ICD-10 CM, how should the pain be coded in relation to the osteoarthritis? A. Code only the osteoarthritis, as pain is a symptom. B. Code both the osteoarthritis and the pain separately. C. Code the pain first, then the osteoarthritis. D. Code only the pain if the osteoarthritis is documented as chronic. Answer. B. Code both the osteoarthritis and the pain separately. This question addresses the coding of symptoms associated with documented conditions in ICD-10 CM. When a definitive diagnosis like osteoarthritis is established, you would typically code the condition itself. However, for conditions where pain is a significant feature and is documented separately or impacts the encounter, you may need to code the pain as well. Check the specific guidelines for the condition, like osteoarthritis, for instructions on coding associated symptoms like pain. In many cases, if the pain is a distinct clinical issue being managed, you would code both the condition and the pain code. It's often necessary to code both the underlying condition and significant symptoms like pain, especially if the pain is being treated or affects the visit. Question 18. In anatomy, which directional term means away from the midline of the body? A. Medial. B. Lateral. C. Proximal. D. Distal. Answer. B. Lateral. This question tests your understanding of basic anatomical directional terms, which are essential for accurately interpreting medical documentation. Lateral describes a position further away from the imaginary midline that divides the body into left and right halves. Medial means closer to the midline. Proximal means closer to the point of origin or attachment, while distal means further away. Knowing these terms helps you understand the location of conditions and procedures. Think of lateral as meaning to the side. Question 19. What is the primary purpose of using modifiers in CPT coding? A. To provide additional information about a service or procedure. B. To indicate the diagnosis associated with a service. C. To report the physician's credentials. D. To specify the location where the service was performed. Answer. A. To provide additional information about a service or procedure. This question asks about the fundamental role of modifiers in CPT coding. Modifiers are two-character codes appended to CPT codes to provide extra details about the service performed without changing the definition of the code itself. They can indicate things like whether a service was bilateral, if multiple procedures were performed, or if unusual circumstances applied. Modifiers help tell the complete story of the service rendered. Modifiers are like flags that give payers more context about a CPT code. Question 20. A patient is diagnosed with pneumonia due to the influenza A virus. In ICD-10, how is this typically coded? A. Code only the pneumonia. B. Code only the influenza A. C. Code the pneumonia and use an additional code for the influenza A. D. Code the influenza A and use an additional code for the pneumonia. Answer. D. Code the influenza A and use an additional code for the pneumonia. This question tests your ability to code conditions caused by infectious agents in ICD-10, specifically following the code first and use additional code instructions. When a condition like pneumonia is stated as being due to an underlying infectious disease like influenza A, you typically code the underlying infectious disease first, followed by an additional code for the manifestation, the pneumonia. This is indicated by code first notes under the manifestation code category or use additional code notes under the underlying disease category. Always check the notes in the tabular list when coding conditions caused by infections. The underlying cause, influenza A, is coded first, then the resulting condition, pneumonia. Question 21. Which type of medical record documentation is most crucial for selecting the correct E/M code level? A. Past medical history. B. Social history. C. Review of systems. D. History of present illness, examination, and medical decision-making. Answer. D. History of present illness, examination, and medical decision-making. This question focuses on the key components used to determine the level of an evaluation and management E/M service. While past medical history, social history, and review of systems are part of the overall history component, the history of present illness, HPI, the physician's physical examination, and the complexity of the medical decision-making, MDM, are the three key components traditionally used to define and select the appropriate E/M code level for most categories of visits. Understanding these three components is fundamental to E/M coding. Focus on the HPI, exam, and MDM. They are the core building blocks of most E/M levels. Question 22. In the CPT codebook, what does a bullet symbol A next to a code indicate? A. A new code added to the current edition. B. A revised code with changes in wording or definition. C. A code that includes conscious sedation. D. A code that requires modifier -51 exemption. Answer: A. A new code added to the current edition. This question tests your familiarity with the symbols used in the CPT codebook to provide important information about codes. A bullet symbol, placed to the left of a CPT code signifies that it is a new code introduced in that specific edition of the codebook. Other symbols, like a triangle, indicate revisions. Paying attention to these symbols helps you stay updated on coding changes. Look for the bullet to spot brand new codes in the latest CPT manual. Question 23. A patient is admitted to the hospital with symptoms suggestive of a stroke. The physician orders a CT scan of the brain to confirm the diagnosis. In this scenario, the CT scan is performed primarily for what purpose? A. Screening. B. Diagnostic. C. Prophylactic. D. Therapeutic. Answer: B. Diagnostic. This question relates to understanding the purpose of medical services, which is important for medical necessity and billing. A diagnostic service is performed to identify or confirm a patient's medical condition or disease. In this case, the CT scan is ordered to diagnose whether the patient has had a stroke, making it a diagnostic service. Screening is for detecting disease in asymptomatic individuals, prophylactic is preventive, and therapeutic is for treating a condition. Services ordered to figure out what's wrong with the patient are diagnostic. Question 24. Which of the following is not a primary focus of the Office of Inspector General (OIG) work plan? A. Identifying areas of fraud, waste, and abuse in federal healthcare programs. B. Outlining specific audits and reviews the OIG plans to conduct. C. Providing educational resources for healthcare providers on compliance. D. Developing new CPT and ICD-10 codes for reporting services. Answer: D. Developing new CPT and ICD-10 codes for reporting services. This question asks about the scope and purpose of the OIG work plan, a key document for healthcare compliance. The OIG work plan outlines the various audits, reviews, and investigations the OIG intends to pursue to combat fraud and abuse in programs like Medicare and Medicaid. It serves as a roadmap for compliance efforts, but does not involve the development of coding sets like CPT or ICD-10, which are handled by other organizations, AMA for CPT, CDC for ICD-10. The OIG work plan tells you what the government is scrutinizing in healthcare billing and operations. Question 25. A patient sustains a non-displaced spiral fracture of the shaft of the tibia in a car accident. The patient is seen in the emergency department for initial treatment. When coding this in ICD-10, which seventh character would be appended to the fracture code for this initial encounter? A, B, D, C, D, G. Answer: A. This question tests your application of the seventh character for injury codes in ICD-10. For the initial encounter for an injury, meaning the patient is receiving active treatment for the condition, the seventh character of is used. Subsequent encounters, D, are for routine healing and follow-up after active treatment, and sequelae are for late effects of the injury. Since the patient is in the emergency department receiving initial treatment, is the correct seventh character. The seventh character, always signifies the very first time the patient is seen for active treatment of the injury.